On that very positive note, we'll get the webinar started. So, afternoon, everyone. I think this is going to be a great webinar. We've got some of the best speakers that we've ever had. And so this is, I'll call it the Mikey webinar, but it's the AED Automated External Defibrillator webinar. And so around or up to 48 or 40,000 cardiac arrests happen every year in Canada. And 9 out of 10 people who receive a shock in the first minute survive. But every minute that we wait, you start to see those numbers come down pretty quick. So this webinar is going to build on some of the quiet and not so quiet work being done in the broader construction sector to really look at what life-saving devices that we have on site. And what life-saving devices we should hopefully get on site. You'll notice that we've got representation from the government, we've got representation from labor management, we've also got the Mikey network here. And so this is going to be an education event. And so not to generalize too much, but it feels like in construction, we've got two main groups of people. We've got the group where they have or someone they know has experienced a cardiac incident, and they tend to be very well informed. They're aware of what the signs and the symptoms are, as well as what you do when a cardiac incident happens. And then we've got a second group, and I'm not blaming them. This is no fault of their own, but they're much less knowledgeable, and they're unaware of the resources out there. They're unaware of what to look for, and they're unaware of what to do if an event occurs. And so a major focus of today is really going to be bridging that education gap, because there's a lot of very easy, in some ways, common sense things that can be done. One of them is, I'll show it here. This is a campaign called Save a Heart. And essentially, we'll put the link in the chat, and we'll send it out as part of the post-event summary. There's a ton of resources out there about really easy things that you can do to make a difference. And so it's a little capsule, and it has baby aspirin in it. And so one thing that you can do if someone's having a cardiac incident, you can give them a baby aspirin. And things like that will obviously make a difference. We're going to hear from the Mikey network. You could have a defibrillator on site. You could have a Mikey on site. That's going to make a difference too. And so as always, I'm here because I'm lucky enough to chair the Joint Health and Safety Committee at ResCon. They're the ones who do all the great work. So Daniel is a member of that. All of our members have members on that, but also the subtrades. We work very closely with a group called ORCA, and it brings in together all of the infrastructure and residential subtrades. And they're the ones who hire people. They're the ones who are out on site making a difference every day, along with our members. So you didn't come to talk to me, you came to hear from the experts. So I'm going to do a quick land acknowledgement, and then I'm going to introduce our first keynote speaker, which is Dr. Joel Moody. And so I'd just like to respectfully acknowledge that we are situated on the traditional territories and treaty lands, in particular those of the Mississauga of the New Credit First Nation, as well as the Anishinaabe of the Williams Treaty First Nations, Huron-Wendat, and Métis Nation. As ResCon's offices are located in Vaughan, we are grateful to have the opportunity to work and live in this territory. And then we'll get Dr. Moody on the screen here. So Dr. Moody doesn't really need an introduction, especially with this group, but I will. So he is the current CPO. He is the definition of what I would call a safety champion. And when we talk to government, he's our first stop. And so one, he's taken the time to understand construction, to understand residential construction. And we've been able to work with him, starting during COVID and beyond on a number of issues. And he's probably the most popular guest we have on these webinars. So thank you again for joining us, and I'll turn it over to Dr. Joel Moody.
Well, Andrew, definitely don't deserve those accolades, because it's not me, it's the team. But first and foremost, I want to say, thank you very much, everyone, for having me come and chat with you, ResCon, the other attendees. So as you may know, Minister Piccini has made several announcements basically relating to the Workers for Workers legislation. And as part of those announcements, there were a couple of items that he's asked the CPO to lead. So led by the Chief Prevention Officer, wants to review the causes of critical injuries and fatalities in the construction sector, as well as launching a consultation on expanding the types of health and safety equipment to be provided on construction projects. And this is there to help inform future prevention strategies. So I want to take a few minutes to chat with you about that consultation aimed at expanding the types of health and safety equipment provided on construction sites. So this is a significant step forward. demonstrates that ongoing commitment to ensuring the well-being of all the workers in our construction industry and sectors. So as you know, the construction sector, and I would be speaking definitely to the converted here, it's one of the most vital components of our economy because you build the infrastructure that supports our everyday lives. However, it's also one of the more hazardous industries where workers are frequently exposed to numerous risks, ranging from falls, heavy equipment, heavy machinery, and even exposure to substances that can cause illness. So while we have made significant strides in many of the recent years to improve the standards and to improve safety, there's always room for improvement. And so how do we find ways to continuously seek those innovative solutions, both regulatory, non-regulatory? How do we embrace potential new technologies that are there to continue to prevent workplace injury, illness, disease, and death? So want to just make sure that, excuse me, you're aware that this consultation that I've been asked to lead is not a bureaucratic exercise. It's a call to action. It's an invitation for all of our stakeholders, workers, employers, safety experts, industry leaders to come together to help me contribute your insights, your experiences, because our common goal is to gather all of those perspectives. Because by gathering those perspectives, it's going to help inform those prevention strategies, not only now, but in the future, such that we're providing the most effective and up-to-date opportunities for our workers. So a few items that we'll be considering during this consultation, always using data to help us identify and understand what's emerging. So as the technologies, the materials evolve, so do the risks associated with those harms. So we need to understand those hazards so that we can proactively develop those solutions to mitigate them. So that's one part of the consultation. What about the current equipment that's already on site? So we need to understand and examine that effectiveness of the current health and safety equipment, as well as what does the first aid process look like? So everything from personal protective equipment, helmets, gloves, to the more sophisticated systems like an automatic defibrillator, dust suppression technologies. All of those things are important because are those tools, either the presence or absence, meeting the needs of our workers? Are there gaps? So that feedback that you will be helping me with is going to be crucial to help answer those questions. And new technology, as we mentioned before. Everywhere I go, everywhere you go, you're hearing about AI. So that rapid advancement technology presents us with new opportunities to enhance safety. Wearable tech that monitors a worker's vitals, to drones that inspect hazardous areas. Those potentials are vast. So we want to explore if and how these innovations can be integrated into those practices of our everyday work so that we improve those safety outcomes. Training and education, right equipment, right time, right place, but you have to be able to use it appropriately. So how do we ensure that the workers are properly trained to use the equipment? So important. What are the best methods? What is the training? We spoke about first aid. We spoke about those opportunities for improvement. How does that fit into this question of technology and life-saving equipment? And last, policy and regulation updates. Are these insights that we're going to gain inform us about what policies and regulations need to be modified? For example, some haven't been touched since the 1980s. So our aim is to create that robust framework that not only mandates the use of the most effective equipment, but also fosters that culture of safety across the industry. So although we haven't finalized the processes and the time, what are those timelines? I do want to encourage you all, and I want to thank you, Andrew, for allowing me to come, because I want all of our stakeholders to participate actively. Share your knowledge and your experiences, because your input is going to help shape the future of safety within our construction sector. So in closing, just want to emphasize, health and safety of our workers is, my top priority. by expanding the types of equipment provided on our construction projects, we know that we can prevent death. We know that we can prevent incidents from happening, save lives, promote a healthier, more productive workforce. And so this is that way through that consultation, you're going to contribute to those outcomes. And I'm confident that with your involvement, we will achieve those new advancements. So once again, to the participants in ResCon, I appreciate the opportunity that you've allowed me to come, spend some time with you, because it's your commitment as well to improving safety that is really exemplary of the system. Because together, we not only build strong structures, but we also build a safer future for everyone that's involved. Thank you very much.
Thank you again, Dr. Moody, for coming and speaking to us today. Now we understand a bit more of the importance on providing our input and pushing forward these health and safety consultations, because they can be vital to on-site within the construction industry and help aid in our health and safety committees, as well as saving lives on our site. And this kind of segues into our next presenters. So I'd like to welcome Hugh Heron from the Mikey Network. And Hugh and Eva will be speaking the importance of placing Mikeys in high-risk public places. Hugh is an esteemed figure in the Canadian real estate development and has been in the industry for over 40 years. He's the chairman, spokesman, and a key advocate of the Mikey Network, where they aim to create public awareness and education about heart-healthy lifestyles. And I believe we're in for a good presentation. So with that, I will pass it over to them. Welcome, guys.
Thank you very much, Jasmine. Thank you very much to ResCon for bringing us here today, because it really is important. Dr. Moody, I couldn't have said it any better myself. We have to work as a team, and we have to talk to the government as well to be partners with us, and they'll be partners with to show them that we've got the right thing going. The Mikey Network was discovered, well, it was started 20 years ago. I was told 22 today. And what happened is one of our partners dropped dead on a golf course. And we decided as a company that we wanted to do something in his name. So we decided because of heart conditions that we bring the defibrillators to the GTA and beyond. Well, one of the things that happened is that we started off thinking that what would happen is that old people like me would be the people requiring the defibrillator. That is not the case. Cardiac arrest has no respect for any age. Our youngest saved with the defibrillator, tough word to say, was a 3-year-old baby. And that's really the key to the Mikey Network. To date, we've saved 50 people. 50 people are living another life that they wouldn't have had without the defibrillator. And the other thing is that and this is personal now, I think that we should have defibrillators everywhere there's a fire extinguisher. Someone would argue with me, and that's not any disrespect to the fire department, because not only do they put out fires, they carry defibrillators with them as well. And the other thing is that the defibrillator is so easy to use. Anyone can use it. If I can use it, you can rest assured anybody can use it. And we've got the best person. There's a song that says, nobody does it better. And I think they were talking about Eva. And Eva does the presentation better than anybody else. So don't let me down, Eva.
Hi, everyone. My name is Eva Namovsky, and I've been part of Harity and Heathwood for over 2 decades, if you can imagine. I'm the president of the Mikey Network, and it's very dear to my heart what we have been able to accomplish in these years. Usually my presentation starts on a very personal note. I'm going to tell you a story about my family. My family has been part of the Mikey Network since I've been part of this company. We come to every event, we talk about it. I tell them all about our saves and our new programs. It's a regular part of our daily conversation, not only to my immediate family, but my expanded family. So one year, I thought at a family holiday, wouldn't it be fabulous if I brought a unit to show everybody how this works? How fun. So everybody gathers around, I take the dummy out, I open the machine, and I'm doing this presentation, and I could not believe that nobody in that room has ever seen how a defibrillator works. So I really had a moment. I ran back to the office and I said, listen, there's a problem because we talk about Mikey. Everybody hears about Mikey, but the majority of people would never take that machine off the wall. They're too scared. They don't know what to do. So I'm going to show you a video shortly on how simple it is. But before we go there, I'm going to ask a question. And this is something you can answer to yourself. Do you know that there is a difference between cardiac arrest and a heart attack? And most people can't answer what that is. So because we are all in the building industry, I'm going to compare it to a house, and you will have a very clear idea and knowledge of what this means. When a heart attack is like the plumbing in a house. It basically means that the flow in your body is not normal. It can happen. You could be awake, you could be sweating, you could be confused, you could be completely disoriented. A cardiac arrest is very different. It is actually the electricity in your body. At that point, your heart is not beating at all. So your normal heart rhythm does this, it beats. When you go into a cardiac arrest, your heart basically shivers or quivers inside your body. Now, this machine is made to detect that quivering. So how would you know whether somebody's heart is quivering? Like, you're not a medical expert, neither am I. So how do you detect that? Well, if your heart isn't beating, it basically means you're not alive, you're not conscious. So your first clue, if somebody potentially has a cardiac arrest, is they're not responsive. And when you realize how important that is to identify somebody that you might not have a medical reason to think they have a cardiac arrest, but you have a clue. And that clue can change the way you react to the situation. Now, today, when we show you the demonstration, I want you to remember timing. So on average, EMS takes about 8 minutes to arrive at a scene from a phone call. That seems like a long time. And it seems even longer when you remember that for every minute your heart does not beat, you lose 10% of your brain function. So in most cases, by the time EMS arrives, that victim is 80% brain dead. That's not a really good thing. So having a Mikey defibrillator on site in a public place is step one. Step two is to have all the people in those areas be able to react and not afraid of pulling it off the wall or taking it out of their vehicle or calling somebody to come help. Now, with that said, I'd love to show you how simple it is. It was going to be a little difficult here, so we did a little close-up to show you how simple this little machine is.
Hi, today you will learn how to use a Mikey defibrillator. If you find somebody in distress, the first thing you should attempt to do is wake them. Hello, hello, are you okay? If they're not responding, chances are they could be having a cardiac arrest. Your first job is to have someone call 911. Please, someone call 911 and bring me a Mikey defibrillator. As soon as the Mikey arrives, open the case and follow the steps. It says pull.
Begin by removing all clothing from the patient's chest. Cut clothing if needed.
The kit also includes scissors to help you remove the clothing.
When patient's chest is bare, remove protective cover and take out white adhesive pads.
Follow the directions of where to place each pad.
Place pad exactly as shown in the picture. Press firmly to patient's bare skin. No one should touch the patient. Analyzing. No one should touch the patient. Shock advised. Stay clear of patient. Press the flashing orange button now.
No one should touch the patient.
Deliver shock now. Shock delivered. Be sure emergency medical services have been called. It is safe to touch the patient.
And hopefully with this short video, you now have the confidence to help someone when there's an emergency. Thanks for joining us.
Good stuff, kid.
So I hope, it took a couple minutes, not a big deal. But I bet you today, you will be able to go into any public space and always pay attention where that machine is. It's never locked. It's always accessible, or at least it should be, not always with our experience, but we always make sure that you are aware that you, as a citizen in a public place, can help somebody live. And, Hugh was very, he made a very good point. It doesn't discriminate. We've had children, we've had babies, we've had seniors, we've had athletes who have, been saved by one of our units because somebody responded. Now, the next person I'd like to introduce is Linda O'Connor. Please, can we play her video?
Hi, my name is Linda O'Connor from the Mikey Network. I'm so proud of how the Mikey Network has developed programs to promote healthy lifestyles and our commitment to placing Mikeys in high-risk locations to help people who are affected by sudden cardiac arrest. Let me tell you about some of our key programs. Number one, the Mikey on Board program. We provide training and we place mobile Mikey defibrillator units in vehicles that travel across local communities. In 2012, this program was launched by Two Men in a Truck Canada. Two Men in a Truck has placed Mikeys on all of their moving vehicles. Another innovative partner is Durham Radio. They've placed Mikeys on all of their event cruisers with Mikeys, and that's a first in Canada. Mikeys Cops Are Tops program is unique. Nobody knows better than the police officers how quickly the unexpected can happen. It is our honor to donate Mikey defibrillators to Toronto Police Services, provincial courts, and collision centers as part of our Mikey Cops Are Tops program. Through our Mikey on the Go program, Mikey has partnered with Go Transit and Toronto EMS Cardiac Safe City to introduce Mikey defibrillators across Go Transit's extensive network, with Mikeys on board Go trains and in Go stations. In fact, the Mikey network is now reaching over 100,000 bus and train travelers of all ages on a typical work day. To make sure the beat goes on at summer camp, we've introduced Mikey Goes to Camp. We're working with the Ontario Camp Association to make going to camp safer and more worry-free. Camps are often located in remote areas. This program eliminates the worry about how long it might take an ambulance to arrive should someone suffer from sudden cardiac arrest. The Mikey Young at Heart program offers high school students the opportunity to earn volunteer hours that they need to graduate. The Mikey Young at Heart app teaches thousands of students CPR and AED. This gives our youth confidence in how to use an AED or how to administer CPR should the need arise. In fact, one of our students was awarded by the Toronto Police Board for saving a life using the knowledge from our Mikey Young at Heart app. The Mikey Kids program ensures that families whose children have a life-threatening heart condition have access to a life-saving AED. The availability of an AED for these high-risk patients gives families and their medical team peace of mind. In partnership with Sick Kids Hospital and others, we make a difference. Let's hear right now from Luke, a young man who was saved by a Mikey.
My name is Luke and I'm Mikey's kid.
He was in gym class doing their fitness test, which all grade 9 students do, and I believe he was doing the chin-up.
I don't remember anything from gym class, and I remember waking up in the hospital a couple of days later.
Without the defibrillator, it would be a different outcome for sure. Within a couple of weeks, Mikey's Network was at our door with a device.
If we go somewhere, it makes us feel more safe that we have a Mikey with us. And if something that were to happen, we could use it and have the best case scenario.
Thank you, Luke. At the Mikey Network, we're working hard to educate and save lives, and we are thrilled to share this with you here today. Thank you.
Thank you, Linda. Linda is one of our board members, and she is probably one of the most passionate women I know about the Mikey Network. And you might wonder, why do we show you all these programs? Like, how does this relate? Here's the part that you are going to take part in. We want to have another chapter. We want Mikeys to be at construction sites. We understand the need. We believe that there is something we can do. We've done this before. We've seen other areas that required this life-saving units, and together we hope we can build on this requirement that our industry and our workers need. Thank you very much, everyone. And maybe, I think we talked about a question and answer period.
Perfect. Yes, we will move into a question and answer. So if everybody would like to put their questions into the Q&A chat function, that would be great. Thank you very much both to Eva and Hugh for joining us here today, as well as just sharing all the great things that the Mikey Network has done and continues to do. So we do have some questions coming in, so we will just jump right into it. So the first question is, how can I get a Mikey on my site?
Well, it's a great question. You can contact us. We can help you figure out how to get your hands on a unit and what that involves. Our Heathwood sites, for sure, all of our construction sites have units in them, as well as our sales offices.
And what's the number?
We'll send a link for contact.
Perfect, thank you. So we will share that in our post-event summary, just so everybody can have a copy of that. So moving into the next question, who do you recommend receives training on a construction site?
So in our case, we usually train anybody who is inside the construction trailer. So a clerk would be great. I always advise maybe, the site super, but now health and safety, if you go through any training, they usually include defibrillation as part of first aid.
But it's interesting what the doctor said about new technology. One of the things that we've got in the construction industry is people working in high rises. And how do you get a defibrillator up at the 16th, 17th story where they're working? And he did talk about those fine little things that could take it up and make it happen. That's part of the new technology. Drones can take them up and take them to the top floor. They should be in every construction site without fail. And lots of signage as well, so that people understand. They may be trained on it, may forget where the defibrillator is. So there has to be lots of signage to tell people where the defibrillator is.
Thank you for that answer, Hugh. No, I totally agree. We definitely need to know where on site those are located so people can grab it as quickly as possible. So the next question is, how many lives has the Mikey Network saved?
50.
That we know of. You have to understand, when we place units in public places, we don't always hear of an emergency that's happened. So we have 50 reported units, and we think it's probably double, if not triple that.
And as I said earlier, a 3-month-old baby was the one that surprised us all when we talked about like cardiac arrest and that it being age related. It's not, it goes for any age. It's really Mikey's the answer to it all.
No, that's amazing. No, it's great to hear how successful the Mikey Network has been. Moving into the next question, what is the feedback you have received from companies that participate in your program?
I think at the beginning when we started this long time ago, there was a lot of pushback. What is our legal obligation here? And that has drastically changed. And really, we worked very closely with Toronto EMS to establish this program. There is the Private Samaritan Act that you cannot be charged if you try to help someone and something happens. So legally, you're safe. And I think it's just an important thing to do as an organization if you have anybody working for you.
And one concern was litigation, and together with the provincial government, we brought in what's it called, Eva? The act?
The Good Samaritan Act.
Good Samaritan Act. So you don't get any litigation when you're using a defibrillator.
Next question we have is, how do Mikey defibrillators differ from others?
They're not. We use all brands. We've used Medtronic, Philips, Zoll. We just call them Mikeys because defibrillators is such a difficult word. We really have worked, again, closely with Toronto EMS and looked at their recommendations for the units they promote at that particular time. And it really depends on what you require. If you need a mobile unit, it might be a little different than something that's on the wall.
It's interesting what Eva said there just now about defibrillator. I was telling her that I just read a study in the English language. The most difficult word to pronounce is defibrillators.
That's because you're Scottish.
Yeah, it's true.
So the next question is, does the Mikey Network provide certified training?
No, we do not. But we do have a variety of groups that we recommend that you can hire to either come into your organization or you can go somewhere. So we will definitely put you in touch with someone. But you don't, I mean, yes, if you are putting a defibrillator in any of your construction sites, you should take the initiative to train a number of people. But today's demonstration really shows you that these are public access. You don't need formal training to help someone.
Thank you. The next question we have is, how many companies are enrolled in the Mikey Network and how many units have you distributed?
So we don't really have a company enrollment per se. Our goal for the last 20 years have been public access. So schools, community centers, rinks, GO stations, as you heard, police stations. And we have placed with our efforts over 3,000 units throughout Canada, mostly.
But the Heathwood is the behind the Mikey Network. It's the company Heathwood that is behind the Mikey Network. Everybody on staff knows about the Mikey Network. Everybody on staff works out, and we are, as the doctor said earlier, we're a team at Heathwood.
The other thing I think that is worth noting is we've developed over the years also a very close relationship with Toronto Sig Kids. To date, we have over 650 children that were provided a Mikey unit from our office. Within 24 hours of their phone call, we're at the hospital handing off the unit so the family can leave the hospital because they can't afford it or the hospital can't provide one. They don't need to stay in the hospital but can't leave without this device. We have 650 kids with that. It's pretty incredible. We're very proud of it, and I hope this just continues. We all have full-time jobs. This is just something we do on the side. Hugh and I do the road show and publicize Mikeys and defibrillation as much as we can.
No, that's wonderful. And we love working with you guys and we look forward to continuing this in the future. I don't think we have any more questions coming in right now. So I think at this time, I'm just gonna thank you guys again for joining us. And you guys have provided such a great presentation and such valuable information. And we will definitely share this with others. And we look forward to having you guys again in the future.
One of the other things, if I may, is that Eva, as she said, Eva and I are always available. And it's easy to get to Heathwood and contact either or, and we'll be there to give you advice.
Perfect. Thank you so much for that. I'm just going to pass it over to Yasmin now, and she can introduce the next speaker.
Thank you. So our next presenter is Ron Kaluski. He was Ontario's Chief Prevention Officer, and he's worked extremely well with the construction industry during the COVID-19 pandemic. Since then, he's retired, but he remains active on many boards and committees, including the Skilled Trades of Ontario. Before joining the Ministry of Labor, Ron was President and CEO of Public Service and Health and Safety Association. So we'd like to welcome back Ron to the ResCon webinar series. Thank you for being here.
Thank you, Yasmin. It's interesting when you see the screenshot. The last screenshot I was on was probably in the middle of COVID, and the hair was a bit of an issue. Anyway, hopefully this will replace that. Thank you, Andrew, for the invitation. Joel, always a pleasure to see you, and certainly Hugh and the Mikey Network and everybody that's speaking today. This is a great topic, and it's near and dear to my heart. And it's interesting how when you plant a seed, you know, a couple of decades ago, how it starts to evolve into something very material. From 1975 to 2003, I actually worked for the former Metropolitan Toronto and City Toronto, and I spent the last 8 years as the Deputy in Chief of Toronto EMS, now Toronto Paramedic Services. So a lot of what you're talking about, I've experienced and seen the evolution of what happens. I just want to give you a practical and a bit of historical evolution of where this is going. So in 1975, when I started as an ambulance attendant, ambulance attendants weren't allowed to do CPR. And defibrillation was exclusive only to the emergency department doctor. And citizen CPR was not permitted, and there was no 911 at the time. And cardiac arrest survival, whether it was in the home or on the street or on the workplace, the survival rate was probably slightly less than zero. There was no system. And the industry got together, the industry that being the public safety industry, as well as researchers in the medical industry. And we looked at it and said, we need a system. We need everybody involved. And that's really been the theme of what Mikey has indicated, that it doesn't work unless the citizens participate, workers participate, the public safety agency and legislation is involved. So during my time with the city, I saw the evolution of 911. We implemented that in the late 70s. We started a citizen CPR program in 1980. In 1984, we introduced the first paramedic program in Toronto. We initiated a tiered response program that was to get as much trained help on the scene as quickly as possible with other first responders. We started the Cardiac Safe City program. One of the first things I did when I became chief in 1998 was to go before council and get their endorsement of the Cardiac Safe City program to put AEDs in public buildings. And actually the first AED went into the Mirvish, I think it was the Prince of Wales Theatre on King Street. And now, if I'm not mistaken, there's probably close to 5,000 defibrillators in the GTA. And later on, we implemented dispatcher assistant CPR, which means even a layperson that doesn't understand or has never taken a first aid course or a CPR course, the dispatchers will provide that information over the phone. And then in 2001, as Hugh had indicated, we actively lobbied to change the Good Samaritan Act, which was Bill 20 at the time, to reduce the liability for people that intervene. And actually the goal was where people said, I'll be sued if I defibrillate. We're now hoping that you'll be sued if you don't have a defibrillator available because it's become commonplace. And out of hospital cardiac arrest survivability in 2003, and actually now we've probably increased it to 10%. And when I say survivability, there's variable ways of calculating that. You can be resuscitated at the scene, you can be resuscitated in the ER, but really it's the percentage that are discharged in hospital without a compromise, either neurological deficits or some other deficit as a result. And then the true indicators, if you're alive after 1 year, then you're truly successful. Now, I do have a presentation. Yasmin, can you bring that up quickly? Or I can just blab, whatever.
Just share my screen.
So there has been some numbers that have been discussed here today. And so the actual incidence of out-of-hospital cardiac arrest is increasing globally. And right now, if you put everything together, it's about 95 or 96 cardiac arrests per 100,000 population. So go to slide 2. So if we look at the GTA, it's about 7 million people. So that extrapolates into about 6,650 cardiac arrests a year, and there's about 2,850 in the city of Toronto alone. And as Andrew indicated at the beginning, 40,000 in Canada and about 12,000 in Ontario. Majority of them occur in the home, and about 20% occur in the public, and you would consider the workplace the public. So it's really important to narrow that time frame between the onset of a cardiac arrest and intervention. And it's really intervention that occurs at the time. So that includes CPR, that includes defibrillation, that includes calling 911, and most importantly, and I'll touch on it a little bit later, having a plan. Some of the construction sites that are in being built around the city, and the well is a good example. Multiple gates, multiple entry points, having a plan, staging area, and making sure that the person that calls 911 certainly tells us how to get there. Let's go to the next slide. So a little bit of research. Did you know 13 million Canadians, it's just about 1/3, have some form of cardiovascular disease. 250 die every day. 1 in 25 construction workers have been diagnosed with cardiovascular disease. So if you do a little extrapolation, 7.6% of the labor market in Ontario, or about 580,000 people, are employed in construction. So if you look at the 1 in 25, about 23,000 construction workers have some form of cardiovascular disease. Not to get too personal, but 1 in 4 construction workers suffer from obesity. 1 in 4 construction workers use tobacco. 50% of construction workers do not get enough exercise. And 1 in 4 construction workers have diabetes. So if we start laying the framework of risk, not only do you have risks inherent risks on a construction site, some of your workers have inherent risks as well that make them susceptible to a cardiac event. Next one. So we looked at the time between the onset of cardiac arrest and the provision of care. And as I mentioned, shortening the time between the event and the outcome is important. So as I mentioned earlier, no intervention and just calling 911, you have probably a 1% chance of survival, with brain damage occurring after 5 minutes. As indicated, most, depending on the time of day or day a week, we always strived as a paramedic service to be on scene under 8 minutes, 90% of the time. Fire services strive for under 8 minutes or under 6 minutes, 90% of the time, and that's why they're key to the system. But then again, 6 minutes, 8 minutes, that's to the front door. That is not to the 22nd floor or the 80th floor or whatever. So you start tacking a whole lot of time on it when you got to find where the person is located once you get to the front door. So when you look at CPR and calling 911, likely 3 to 5% for survival after discharge, CPR, AED, and calling 911. The global range, depending on where you look, is between 6 and 22%, but roughly about a 10% survivability after a month with favorable neurological outcomes. So really, the theme, the Mikey theme, the theme of having that intervention in a trained person is really important. Next slide, please. So these are the factors that have led to our improved outcomes. So dispatcher assisted for those people that don't know CPR, improvements in basic life support training across the board to both public and to key people within the workplace, bystander CPR, reduced time to initiate CPR, and increased availability of automatic external defibrillators. So in a study that was done, and we did a lot of studies in Toronto, largely because we're a great big service and 2,850 cardiac arrests a year. It's a petri dish for looking at ways of improving interventions, whether it's through pharmaceuticals, whether it's through the system response. But the research has said these 5 things have caused the most important impact for out-of-hospital survival of cardiac arrest. Next slide. So the barriers to success. So the biggest barrier to success is reluctance, and that was mentioned. And we changed the legislation in 2001 to make it less likely that people would fear that there'd be legal liability for intervening. But reluctance is the big problem. Having an AED is great, but not using it doesn't help. Knowing CPR but being afraid to use it doesn't help. So intervention and trying to get people to intervene is really important. And just remember, I always said that a significant percentage of the population in the city of Toronto live 12 feet off the ground. So as I said, you can get to the address in under 8 minutes, but it takes you several minutes to get to the 15th floor. Take a look outside Toronto, the GTA. There's more tower cranes in Toronto than there is probably in any other city in North America, perhaps all of them combined. My daughter lives in Chicago. When I look at the Chicago downtown skyline, I only see 2. So, you know, take it from there. And when we start looking at the size of some of the residential construction sites being contemplated, like the Greater Golden Mile, 77 residential towers supposed to house more than 50,000 people. Mervis project, 2 towers over 90 stories high. The Well is an example, and many other large, you know, surface housing developments across the GTA. They're big, and you know, consider as well. I've refused to drive downtown because you can't. You know, if you take the streetcar from Jarvis to Bathurst, you can walk faster. So think of an emergency vehicle. It's really tough to get to some parts of the city very quickly. Next slide. I think, you know, being successful, you know, and I really welcome what Dr. Moody had indicated about doing an analysis of what's needed on a construction site. It's interesting to note that we've in the paramedic industry, there are cities that have, as part of the emergency response system, testing out AEDs on drones. And with GPS technology, you say to the emergency dispatcher, I'm at the corner of Yonge and Bloor. I know how to use a defibrillator. There isn't one there. And 3 minutes later, the drone lands beside you and there's the AED. So lots of things are happening, but having a fully stocked first aid kit or kits, depending on the size, fully trained individual or individuals that have not only first aid, but CPR and AED, administration of naloxone and perhaps an auto-injector EpiPen on large sites, and in some cases more than one. And as Dr. Moody said, the Working for Workers acts, and there have been several of them. I think there's 5 iterations that have been rolled out. Bill 88, which I was involved in before I left, was naloxone kits. And, you know, there are other interventions that I'm sure that will come along. So when you think of the investment that you put in your materials, your equipment, your activities on site, some of these interventions are quite inexpensive when you look at it. Naloxone kits, AEDs, EpiPens. Most AED, you purchase them from an AED provider. It comes with warranties. You can get them in a box that sends a message that the batteries need changing. They're warranted where the vendor will come and actually maintain your system. So there's maintenance plans, and there is I was part of a discussion a while back where there is a global initiative to create an app that wherever you are globally, you will know where the nearest automatic external defibrillator is, and it will show up on your app. So next slide. So lastly, I just want to thank Andrew and ResCon. You know, they've always impressed me as being really out of the gate first. And, you know, they were groundbreaking with mental health in addictions and construction. They were colleagues side by side during COVID with both testing and vaccinations, site cleanliness, and they're now addressing, you know, emergency health and preventative measures. And I think it's also based on, you know, the incidence of cardiovascular health, that tool talks, when you look at, you know, don't fall, don't watch you don't get struck by some of the more common areas on a construction site, or wear your PPE appropriately. The trained reactive response is great, but I think we can start looking at lifestyle choices to start looking at preventative measures in cardiovascular disease. So, you know, we do as much as possible to eliminate the frequency of use of some of the immediate, but also start dealing with the longer term through lifestyle changes in health. So thanks, Andrew, for doing this. It's great, and thank you for all the participants.
Thank you, Ron. It was really nice to have that kind of first responder perspective on the insight and the importance and benefits of training, as well as having multiple AEDs on site, as well as kind of what a look into the future for AEDs, as well as preventative measures have for us. I think we have time for a couple questions. They're just coming in. So first question we have for you. What do paramedics need to know when they arrive on site, when there's an AED versus when there isn't one?
Generally speaking, if there was a defibrillation and it was successful, they would probably want to know the number of shocks that took place, because sometimes it doesn't happen on the first shock. It recalculates and does it again. Length of time the person was unconscious. Was it a witness cardiac arrest? Did you find the person? And, you know, if the cardiac arrest defibrillation was successful, then, you know, telling them they are breathing on their own, or we've detected a pulse. So some of that to give them a perspective of length of time and status on scene. And obviously, where is the patient and how do I get there is probably the quickness. So having somebody at the gate is really important.
Yeah, exactly. It's important for them to know where they need to go, what they need to do, what's going on. We have another question here. What can employers to better work with paramedics in the GTA? Should we be reaching out as an industry, or should it be employers to reach out before there's a crisis that happens? How can we go about to make it a little better?
I know that Toronto Paramedic Services have a community response, and if a large site, and again, I'll use the well, for example, that's the one I'm most recently familiar with, big, complex, multi-site, is actually to call them and say, can you come down to a site visit? Because they can make available information to each ambulance has a computer in it. So for example, they do have maps of various locations, like the Pearson Airport as an example. So those complex areas where they would know that there's 9 gates to get into, and most of them are on Wellington, but there may be one on Spadina. So that it helps the responding crew navigate their way around the site. So they would be more than happy to help. It's like emergency preparedness in a micro scale. They do it on a citywide scale, but they also do it on a micro scale.
I think we have one more question for you. So what are things paramedics wish employers knew before, during, and after an emergency?
Well, I think beforehand, as we've talked about, that there is a crisis plan with as much of an order amongst chaos response as possible. That there is an AED, there is people that know where it is, there are people that can use it. There is a mustard area where if something happens, the person that's charged with calling 911 can articulate where the person is. And once it's done, whether it's successful or unsuccessful, like any other health and safety accident or incident, ensure that if there's a medical emergency, it's treated in the same way from a health and safety perspective as you would a physical injury that occurs on site. Did we do it well? Did we do the best we could? Are there things we could do better, so that you assess that, so the next time, God forbid, if there is a next time, you're doing it a bit better. And just I just want to make a last comment that, out of the 40,000 cardiac arrests that occur in Canada, about 3,100 of them are brought back and are discharged without any sort of neurological or other deficits. And most of those people live 10 years or on, 60%, 70% live beyond that. So regardless of the age, it's worth the intervention, because we're talking about saving people's lives that they can return to be productive citizens. So it makes good sense.
Exactly. Completely agree. Well, thank you again for being here with us. It was nice to have you back on the webinars. It's nice to hear the perspective, kind of a little bit more on the factual side, the number side, especially when it comes to life-saving measures. I'm going to pass it over to Meredith now, just to do a couple poll questions.
Perfect. Thank you so much. And thanks again to Ron. That was great hearing some great statistics regarding cardiac emergencies. So we will now move into some poll questions where we will welcome some active participation in there. This will help provide us with a baseline to understand where the construction industry is at in terms of AEDs on site. So I'll give everybody some time to answer this first question. So the first question is, do you have an AED on site? Let's give it a few more seconds before we move on to the next one. Okay, so I think we'll move on to the next question, but that first one, we do have 100% of the people that have answered that question. They do have an AED on site, which is great to hear. And if you do have any questions, please just throw it into the chat. Just give me one moment. So moving on to the second question. Who was responsible for maintaining the device? So we have health and safety rep, frontline manager, site clerk, other, and you can list those in the chat, or you don't have a device on site or in your office. Looks like we're getting a good mix right now of answers. Let's give it a few more seconds. Perfect. So moving on. So for that, we had, again, a mix. So we had a health and safety rep, frontline manager, or even a site cleric, receptionist, or clerical staff. So the next question is, do you require AED training? Just a simple yes or no. And thank you, Ron, for the comment in the chat, just reiterating the point that you do need to designate a person that's responsible and ensure the availability on site at all times. So for that one, we did actually have a mix of whether they require training. So we had 56% say no, they do not require training, and 44% respond yes, they do require training. And again, if you do want some training in the future, please reach out and we can share some resources with you. So for question 4, if yes, who is required to have that training? So we have the Joint Health and Safety Committee, a union steward or safety rep, 4-person crew leaders, all workers, or we do not require training at this time. Perfect. So for this one, we had a mix for the answers. So we had 25% respond that it's the Joint Health and Safety Committee, 38% respond union steward or safety rep, 50% with frontline management, such as 4-person or crew leaders, and 38% respond we do not require training at this time. So for the next question, what percentage of your on-site workforce has AED training? This is best guess. We don't expect you to have the exact data, but there's a few options there for you to choose from. Got some last minute ones coming in right now. So for the answers, we had 33% said less than 10% of the on-site workforce has AED training. 22% responded that 10 to 25% of their workforce on site has AED training. And lastly, we had 44% respond 25% to 50% of their workforce on site has AED training, which is great to see. So question 6 is, what is the main barrier to including an AED on each site? So this could be either cost, location and storage, training, liability, or even something else if you would like to list it in the chat. Okay, so for this one, We had the top two answers as cost and location. And then the last question is, has your work site or someone you know had a cardiac incident? We had everyone answer this one, so I'm going to share the results. So 88% of people do not know somebody on their work site that has had a cardiac incident. And we did have 13% respond that they do know somebody that has had a cardiac incident on site. So thank you for participating, and we're excited to use this data moving forward, and we can definitely share it in the post-event summary. So moving on, I think we will pass it over to Andrew to introduce the panel.
Perfect. And we'll just add the panelists to the screen. We'll get going here. Perfect. No, we gotta get Daniel. Where did he go? Perfect. Okay, so we're moving forward now with the panel portion. And so what we'll do is you three individuals certainly are safety experts. And so what we want to do is give you an opportunity to introduce yourselves, and then we'll get right into the questions. And so using my screen, the first person I see is Carmine. So I'll get you to introduce yourselves.
Good afternoon, and Andrew, thank you for hosting this. And considering the heat wave we're going through, it is a very interesting time to have this topic. As I'll discuss it earlier, heat and heart conditions go hand in hand. My name is Carmen Tiano, and I work at the Ontario Building Trades. I work with Andrew quite closely at the Section 21 Committee, and we represent 15 trades with a membership of close to 200,000 in the province of Ontario. And I think that cardiac issues are central to what it is, an issue that needs to be dealt with in construction. So thank you for putting this topic on.
Yeah, and typically we like to try and get ahead of issues. I think we didn't necessarily we expected a heat wave this summer. I don't know we expected it this early, but you're right. You look at the stats, and heat certainly, increases the odds of a cardiac incident. So we'll have to get into that today. Next on my screen is Sean.
Hi, good afternoon. Thank you to ResCon for having us. My name is Sean Delaney. I'm an instructor with NORCAT. If you're not familiar with NORCAT, we are an occupational health and safety instruction and advisory company. And we've worked closely with a lot of people in the residential construction sector, as well as heavy civil construction and mining and forestry and all sorts of industries, really. I teach all sorts of occupational health and safety courses for NORCAT, including Joint Health and Safety Committee, levels 1, 2, and a refresher, investigation courses, equipment courses, things like swing stage, then confined spaces, entry, attendant, and rescue. But one that I teach probably at least twice a month would be first aid and CPR, including the use of AEDs. So thank you for having me today on this panel.
Perfect. And then last but certainly not least, we'll go to Daniel from Tridel.
Good afternoon, everyone. Thanks, ResCon, for allowing me to participate in this panel. I'm the Director of Health and Safety at Tridel, a high-rise developer in the GTA area.
And so what we're going to do is we're actually going to start with you, Daniel. And so when and why did Tridel try to incorporate AEDs onto their sites? And can you let us in on some of that experience that you went through?
Sure. So Tridel started incorporating AEDs back around 2010. The main reason was to make sure that if anyone had a cardiac emergency, there would be immediate help available to them. Given the nature of the construction industry, we thought it was crucial for us to have that extra help, that extra layer of safety. The whole experience, to be honest, was quite positive. Our employees were really open to the idea. They understood exactly why we were doing that. But they did have some questions, though, about the liability, the training needed to use the devices properly. So to address that, what we did was we set up training sessions through a third-party organization, well-known in the industry. So everyone from the site coordinator to the most senior person on site, all of them would know exactly how to use the defibrillators. Then another thing that we did was to make sure that every defibrillator was manufactured by the same company. So we knew exactly which product to use. They knew exactly how to maintain it, how to keep in good condition, and so forth. And then we updated our policies just to make it clear to the employees that they would be protected when using a defibrillator in good faith during an emergency case. But then as we were implementing that process through our projects, we decided that the AEDs should be made available not only to the workplaces, but also to the communities that we're building. What we did was we implemented, we installed defibrillators in a lobby area, and I believe that we have a picture that can be shared with everyone. So we have those defibrillators installed in the lobby area. They're stored in a beautiful stainless steel cabinet, and it blends perfectly with the design that was put together by our team. So the way we feel that by doing that, it's a way to demonstrate how important it is to have a defibrillator near anyone. So that's what we call the try that way, to make sure that our residents have that peace of mind, and at the same time, to show them that we're also committed to their well-being.
Yeah, so whenever you get a chance, Meredith, feel free to share that picture and we can walk through it. But while we're here it is.
Exactly. So as you can see, that's stainless steel cabinet. They also have an alarm system. We have a flat option as well that kind of like blends perfectly with the wall. Ron mentioned before about the well, for instance. It's such a big, large project that we proudly participated in building that project. Just that project alone, we had about 10 to 12 defibrillators once we got close to occupancy stage, including construction and occupancy process.
Yeah, and then here, I guess here's a second picture. Perfect.
That's actually one of the units at the well down in downtown Toronto.
And so I think we heard most people, but certainly Ron talked about it quite a bit. Accessibility. So it does no good if nobody knows how to get to it or where it is. I don't know, Carmine, do you have thoughts on that, or you want to touch on that?
Yeah, it was interesting when I heard Ron and I talking about, well, first Joel started with his idea of how AI and advanced technology can help us get where we want to go. But one thing that I really think is important, before I answer your question, is I like what Hugh and his group have done. They've turned this into a societal problem. Hey, cardiovascular incidents happen. It can happen to any age group. And here is something that can mitigate against someone dying. So Hugh has already created the buzz out there that it's a societal problem. Now, the other thing that I've heard that Tridel has done is, wow, you're now in our buildings, they're being put that it's there. So the location part, that's going to be the tricky thing, Andrew. Now, I live near Yorkdale. There's this right across from Yorkdale. There's these 3 massive residential towers going up. These things are maybe 30 stories. So in my mind, I'm saying, wow, where would you put them? Okay, so I think what we need to do, first, we need to accept that it's a societal issue. Then we need to say, okay, what are the logistical plans? Now, maybe Ron can help me with this. A few years ago, there was a bill, was it Bill 141 in Ontario, that they're going to be a repository of defibrillators? Did that ever get passed? Ron, you still on?
No, I'm not sure, but I don't think so.
Okay, in 2020, there was this bill 141. It was going to be with the Ministry of Health. And there's going to be a repository of where these defibrillators would have been placed. So I think you first start off there, Andrew, having a repository where they are. Then after that, now you have the Ministry of Health involved. Then you have the other ministries, interagency coordination. Then you can start having a plan of where things are. And then the workplaces get involved. Boom. And then you have your logistical plans in place, best practice of where to put them and how to get them there. So I think there's a couple of different things that need to happen.
And I think maybe this is a good point to go to Sean on as a training provider. Obviously, when builders are looking to get an AED on site, like if you're not one of the first calls, you should be. But I'll turn it over to you, Sean. But
Okay. Thank you. So in terms of training, I know despite what Bill 101 might say, I honestly believe this is the type of training that, virtually everyone should receive. I would like to see it part of, training for basics of construction. And I definitely think it should be part of everyone's supervision or managerial level training. The more people we have trained, the better. And, to what we were all talking about here, the more accessible these devices are, the better. So when I'm delivering the training, one of the things I like to think about is, can we remove some of the barriers or some of the intimidation of the unit or the device itself? And in the course of a class, oftentimes I'll try to find someone who seems to be, the sort of least outgoing or the least gregarious, and I'll ask them, okay, can you show me how to use, this AED trainer right here? It's very, very simple. And then without any further instruction, I hand them the device and see how far they get in terms of figuring it out. And virtually every single person does it perfectly the first time. There's a map on the back of the pads, there's the device itself. So, once people see that and they see, oh, well, that's not so bad. And then we work on, doing it better and better and better and some of the more finer points and, making sure they understand, how it works, why it works, and, when it's appropriate to use and when not.
Just taking the mystery out of the machine is one of the onboarding things. I think that's fantastic. And I kind of want to come back to Carmine. I think we agree, I think, on a lot of things, but I think one thing we agree on is we probably need to use the Joint Health and Safety Committee more than we are. So, I mean, you're here as a labor representative. So I guess my very specific question to you is like when an employer is looking to bring an AED on site, but I guess more so in general, like what's the union's role and what are some recommendations to get labor and specifically that Joint Health and Safety Committee more involved?
Yeah, okay. Well, the Joint Health and Safety Committee, has a role, but unfortunately, Joint Health and Safety Committee are only going to be with there's a litmus test of when you have one. So bigger projects last longer than 3 months. So let's take it on those sites. Those sites are normally the easier ones to put it on. More sophisticated, more receptive owner client, better training. So definitely you would get the Health and Safety Committee involved. The union do have a role to ensure their members, the same way that the unions have stepped up, I believe, when it comes to dealing with the societal issue of opioids, on having their members trained on how to administer naloxone, etc. So definitely there would be a role. Now, the nice thing about the unionized sector, you have the joint employer union training trust funds. So there will be a nice synergy to get union members trained on how to use these devices. So it would be a really, really nice fit. And I don't really think you would have much of a problem on this. I really don't.
I would agree with you. And maybe we'll go back to Daniel here, because obviously Tridel is a big builder. You have big projects and you have, a great history of success with your Joint Health and Safety Committee. So just to share your experience.
Yeah, when we look at especially high-rise developers, when we're doing a project, the environment changes quite often. So you gotta consult the Joint Health and Safety more than once. It's not just one-time thing and that's it. Like the scenario will change drastically every few months or every few weeks. So then it's important to get them involved, because now your defibrillator might be in a site office trailer on the ground level. All of a sudden now building keeps extending, it keeps going up, and then now you have to change your office to maybe midsection of the building. So then now you got to discuss again where would be the best possible location to have that AED. how to get to different places. Like Ron mentioned in the past, discussing how the emergency services would get to the building and so forth. So all that, when you sit down with them and explain the reason why we're having that, when you explain that there is a need for us to actually practice an emergency situation, then things get much better. Everybody gets to provide their feedback. They're willing to participate. If everyone feels part of a team that is actually focusing on get things better for everyone, not just the workers on site, but also the community if they need that type of defibrillator. So then I think that once you get everybody together, when you work with them, when you make them feel part of a whole process, then things get implemented much faster.
Yeah, so it's the idea is you need communication, but you really need to create the platform for good communication as well. So back to Sean. I know you work a lot with employers. Do you have a lot of experience with joint health and safety committees as well, or?
Yes, I do. In fact, for the company I was working for prior to coming to NORCAT, I was first a worker member rep, and then a management rep, and then the management chair for that JHSC for close to 15 years. And now here at NORCAT, I do teach Joint Health and Safety Committee levels 1, 2, and refresher, and we do that at least once a month. So we do work very closely with the JHSC. When I was running Joint Health and Safety Committee, and we were conducting our Joint Health and Safety Committee monthly inspections, I would ask my worker member rep, hey, can I come along? Can I accompany you? And I'm like, yep, sure enough. And in fact, I would like to get as many of the worker member reps as possible to do those inspections together. And in the course of doing that, I would say, hey, don't forget, we got to stop and check out our AED. And so we would take a look at it, and all you're really doing is, in terms of a monthly inspection, does it still turn on? Does it still turn on? No one's messed with it. We've got all the associated equipment we need with it, the scissors, the towels, PPE, all that sort of stuff. And, then I would oftentimes give them a quick little run through there. And it doesn't need to be, crazy, as Hugh demonstrated there with Mikey's network. You can do a quickie refresher about an AED, very easily. You can even be part of a toolbox talk or a safety talk.
Yeah, and maybe that's a great area to focus on a bit too, is toolbox talk, safety talks. I don't know, Carmine or Daniel, if you want to jump in. And one, it's good to introduce, I think you said, Daniel, but how do you keep it front of mind? But either of you want to jump in on toolbox talks or any other issue there?
Yeah, sorry, go Carmine. Sorry.
No, go ahead, Daniel.
No, go ahead. It's just
one of the things that I notice. Remember, I'm stuck in my office, and I noticed that work sites have these great plans. They're fantastic. But, and I think Sean kind of got to it, what he just said, that they don't grow and they don't adapt as the project continues. So for this to actually work, Andrew and everybody, that people need to know that, hey, it's here. It was in this location 2 weeks ago. Now they're here. So it's going to be something that needs to be continuously stressed upon. And toolbox talks, I think, is one of the best ways to let people know, hey, we have an AED. Cardiovascular could be something like today, heat. We know that heat causes cardiac infractions or cardiac situations. Hey, we have an AED. We have watering stations. We have this. So if it becomes just part of your general safety talks, Andrew, almost what I like to call a total worker health model, then it becomes part of your mindset. And if something happens, here's the first aid, here's the AED, here's where I can go. I think we need to maybe look at it that way.
Yeah, and I'll go back to Daniel, but I think you're kind of hinting at as well. Toolbox talks are not for when there's a problem or an emergency or one-offs. Toolbox talks have to be all the time. And then as you're noticing new hazards or you get into different seasons, then that kind of drives what you're talking about. But I'll go back to Daniel on that idea and kind of the toolbox.
Yeah, I totally agree. And what we found that was useful for us was to look at different topics that are somewhat interconnected. For instance, if you think about, like Carmen mentioned before, heat stress, then you think about naloxone, or you think about fall rescue, for instance. So all those topics, at one point, you got to talk about how to use the defibrillator or how to perform CPR. You got to do it. First aid is part of it. So you got to keep that in mind. So usually what we discuss with our teams is make sure that when we're discussing these particular topics, make sure you include that part of it. So then it makes it easier. You're not just talking about that subject every 6 months or once a year. You're actually talking every so often. So everybody memorize. Everybody knows exactly what to do. It gives everyone the opportunity to also bring concerns or comments, suggestions. So then you can mold the way you do things as you get that feedback. And then that's why it makes it more successful at the end of the day.
Yeah, no, those are great points, and maybe we can go back to Sean. So, I mean, we've heard it kind of throughout this whole panel out through today. Training is an important part of this, and it's an important part of successful implementation. And so, as a training provider, like, what do you want an employer to know? What do you want workers to know? Like, what do you want people to know as a training provider?
Well, as a training provider, just sort of piggyback on what Daniel was just talking about there, that training is always ongoing. And whether I'm teaching fall rescue, confined space rescue, or, again, using an AED, what I remind people is you have to master the mystery through repetition. You can't just practice until you get it right. You got to practice until you can't get it wrong. And so employers need to be aware of that it's not just a matter of, ticking off some guy or some girl's box once every 3 years. Yep, they got the first aid training, great. It's a matter of ongoing repetition and ongoing practice. So, and this doesn't need to be a barrier. It doesn't need to be very time consuming. Again, you can do a quickie refresher with a toolbox talk or a tailgate talk, every 15 minutes, or sorry, excuse me, 15 minutes, once every couple of months, just to keep it in that rotation. Like, oh, hey guys, it's been about 3 months or so since we talked about using an AED, or to what Carmine was saying, maybe where it's been relocated. Let's review this. Let's review this. And you keep hammering at it, keep hammering it, and then it just becomes part of what you do. You don't even think about it anymore.
Yeah, I like that. There's a difference between understanding it and mastering it, and getting to a point where it, becomes muscle memory. So
that's right.
I think that's very good. I think on the training side, we've touched on a little bit, Carmine, there. I mean, I do have to give you an opportunity to kind of talk about heat, because, it's hot out there and we're kind of in a heat wave, and they are related. So
yeah, it's funny. There's a lot of great work that's been done on climate change and environmental and occupational health, right? But it's there. We know that, okay, let's face it, I think Ron's stats were pretty cool that showed 1 in 4 construction workers have diabetes. 1 in 4 construction workers don't exercise. Just because you work in construction doesn't mean you're the healthiest specimen, right? Mm-hmm. So we got to face that, right? So there's a lot of this research out there, and a lot of the cardiac issues that happen on a work site don't necessarily are the result of work. Just because someone's on the site doesn't mean that it's the result of work, right? So now there's all this stuff, and we know that heat is a problem. So when you have days like this, automatically, good workplaces, hey, the instances of someone have a cardiac situation are higher. Let's make sure we have the AED. Let's make sure we tell the staff where the workers, where it is. So you prepare. I don't think that's happening. Like even today, it's 34 degrees, almost 100. I think if it would have been me, I would tell our guys, here's our AEDs, just in case something happens. If something happens, we're ready to go. So I think, Andrew, we need to start get better at planning for these events, because what we're seeing for the next couple of weeks is going to be the reality. We're not going to walk away from this, right? Because there is a correlation with heat and cardiac instances. The literature is very clear.
Yeah, and I think certainly at ResCon and our members that I'm aware of spent a lot of May and even parts of April getting ready for the summer. And I think your point there is, don't wait for it to get hot. It's too late, right? And engage the Joint Health and Safety Committee and make sure that you've got the cooling stations, everything else there. But I mean, I'll turn it over to Daniel or Sean if you got kind of any comments and or anything to add on to Carmine there.
Just to add on to what Carmen was talking about, also for employers and supervisors and everyone here, that one of the biggest factors in heat-related illnesses is acclimatization. So we really need to watch out for, new Canadians or possibly even people new to this province. For example, where my mom's from in small town Newfoundland, 70 degrees is a heat wave. So she can't take heat like this. And she's been living in Ontario for 40 years, but she still is not acclimatized to this intense heat. And we need to be aware of that with, again, new Canadians, new employees, people new to the province or new to the GTA and new to construction. They may not have that wherewithal or may not be as in tune with their mind and body, to pick up on some of the signs themselves.
And
Go
ahead. Yeah.
Interesting what you just said. My family resides in Washington State, in Seattle. In 2021, the temperatures in Seattle got to 40 degrees. 40 degrees. They're not used to that.
Yeah.
So the acclimatization. Now, if you're someone that lives in Kuwait, 40 degrees, it's fine.
Mm-hmm.
But for us, it's completely different.
That's right.
Like I was just in Egypt and it hit. It was crazy. The temperatures, how they hit. So my body, I consider myself to be in good shape. My body, I felt it after a couple of hours. So you were 100% right with the acclimatization. And our workers need to understand that too. That's a good point.
I would also like to add another point. Yeah, sometimes contractors, subcontractors, they don't know how to communicate that information to their workers, especially if they have a variety of workers from different places in the world. Like most recently, we introduced a platform that helps us to communicate the site requirements, some of the things that we do. So we have this platform where workers can attend orientation in their language, and then they get information on where the defibrillator is, how to deal with other issues on site, and so forth, what the responsibilities are and what the rights are, and so forth. So that way, if we introduce things like that, if we step up and we do whatever we can to help when it comes to educating, bringing awareness, that's definitely helpful for everyone. At the end of the day, everybody knows how to proceed. Everybody knows how to help each other, and we'll minimize the issues that we see now with people coming from different locations in the world.
Yeah, and then just really bringing it back, and this question's for anybody. Like construction is transient. The formwork guys and men and women, they're going to be there for a long period of time. You have some trades that come in and out. And so it's just bringing it back. And if anyone has comments around the access or the fact that, some sites can be quite large. You can have 200, you can have 1,000 people on a site. When you've got that flow of people, like what can you do to overcome those challenges? Again, I'll open it up to anybody.
Yeah.
I mean, to me, like what I've seen members do is always, it gets back to that on-site orientation. But again, I don't want to put words into other people's mouths, but.
Yeah, to me, it's the best way of going, educating, bringing awareness right on the first day. So it sets the whole process for a better environment in the workplace.
Yeah, I think if, like anything, if you see that the work site has a plan, you have you have plans in place for cold weather. You have plans in place for extreme heat. And the supervisors and the actual unions are reinforcing them. Hey, Carmen, boom, here's what needs to happen today. It's going to be extreme heat. Here are the plans we have in place. And it continues to happen, Andrew. I really think, doesn't matter that how many workers you have on site, all of them start rowing in the same direction. I know it sounds simplistic, but if workers see that there's that commitment, the plan is there, the plan is adaptable to the circumstances, I think people will follow it. I really, really do.
And I
Do we
guess it
not
really
need
gets
to
back to
have
that culture of health and safety. Like you either got it or you don't, and you need to be working.
Yeah, we're creatures of habit, right? Bad habits and good habits. If the habit is good, we'll follow it.
Yeah.
Listen, I think.
Well, I'm going to start to wrap this up here. We still have a bit of time, but I like to end the panels with a key takeaway. So I'll give each of you like an opportunity now. What's one thing you want people to take away from today's webinar, or kind of what you've been able to say during the panel? And we'll start with Sean.
Thank you. Well, just to add on to what Carmen and Daniel were just mentioning there, orientations, capturing everybody like right at the start, that's great. And yeah, because we've all seen some orientations that, you know, really aren't worth their time. And so with like a real orientation where we share pertinent information. And then what Carmine is saying, you know, when people can see that there's a plan going forward, you know, we all know that, you know, it's going to get hot in summer, you know, so this isn't news. As leaders in construction and in occupational health and safety, we need to be planning and demonstrating, you know, what to do, not reacting. So that would be my big takeaway. I'd say don't react when it comes to health and safety. Let's be proactive, have a plan in place, have that good orientation, teach them the AED.
No, I think that's a absolutely fantastic point. We'll go to Daniel for your final thought.
Yeah, if your organization is thinking about adding AEDs to your place, remember that it can benefit not only the workers, the employees on site, but also the broader community. Don't let fear or uncertainty hold you back. Just take action, plan, just have a discussion with your team, get them involved in the process, celebrate achievements, and you will be amazed at what you can accomplish and how it can lay down the foundation for future safety approaches that you may have on site.
Yeah, I like that. So this is part of a larger, all-encompassing kind of approach to health and safety. Yeah. And Carmine, we'll give you the final thought.
Yeah, I think that one of the biggest takeaways, this cardiac situations, as the stats indicate, are a societal issue. And if we could prevent something happening at the workplace with an AED at very limited costs, with minimal training, and it's not invasive, there's no reason we should not be doing it. Because also, if we look at this idea of a total worker health model, that falls into it. So it is a societal issue that we can deal with. If it happens at the workplace, we're prepared.
Yeah, no, I think that's a phenomenal point. I mean, you can't argue with the law of large numbers. Ontario is a big province, and statistically, and I think what was it, 40,000 cardiac incidents in Canada? Ontario is about half, just from a population point of view. So I would think, you know, 20,000, that's a large number. They're not all going to happen on site, but certainly to your point, Carmine, we can be ready if and when they do. So thank you to the three of you. Thank you for the work that you guys do every day, but thank you for taking the time to dive into this issue. So we really appreciate it. So we're going to say goodbye to you, gentlemen. I think we're going to bring Meredith up to do some kind of final remarks.
Perfect. So we'll just do some quick closing remarks, and thanks again to the panel for that great discussion, not only on AEDs, but just health and safety in general and heat stress. So thank you to all of our amazing speakers and attendees for joining us today. We hope the discussions provided valuable insights and information that can be utilized in the construction industry in case of a cardiac emergency. We are pleased to make a donation to the Mikey Network in support of their incredible work. The post-event summary will include a link to the recording of this webinar, as well as some additional resources. Thanks again, and we look forward to continuing our efforts in this area. Have a great day, everybody.
Bye, everybody. Thank you. Bye.
Take care.
Thanks to all the speakers for taking the time. And Hugh and Eva, I don't know if you know, but we always try to make a donation when we do a webinar in lieu of sending gifts or thank yous to the speakers. And so in lieu of speaker gifts, we're going to make a donation to the Mikey Network. So
thank you. Bye, everybody.
That's on behalf of the speakers. So thanks to the speakers. So.
Thank you so much. We really appreciate it.
Keep smiling, Carmine.
Oh, thanks. Bye, guys. Keep up the good work. Keep up the good work. Bye.
Thanks,
Take care, everyone.